Welcome back to Face It with Dr. G. I'm Dr. G, and I'm so excited to be back again today to discuss a topic that I really, in my mind, have talked about in the past, but I really haven't, and that's match day. And medical students go through the match process when they are transitioning from medical school into their residency program, and it's a big deal. And my dear Rachel messaged me a couple of days ago and said, it's match day. Should you say something on your story? And of course, I forgot. And then I woke up this morning and I said, this would be a great podcast and YouTube. So I wanted to share a little bit about my journey with all of you and how I ended up where I am. And I'll go back to medical school, which getting into medical school is a whole different process, right? It's a long application process. You apply to many different schools and take tests and all of that. But once you're in medical school, what is that journey like? It's a 4-year process, and it's a process not only for me was it self-discovery, at least I thought, because I'm still discovering myself every day, even more so now. It was a process of self-discovery in the sense that when you're in primary school and in college, it's very structured. You go to class. I thought I had clear expectations of what was needed, and you have tests and finals and all of that. When you get to med school, it's a little bit more unstructured, and I think that sounds weird, but to me it was. I didn't have control over myself. I was too worried about what everyone else was doing and the competition and everyone's smarter than me and all of these thoughts I had. So I had to figure myself out really quickly. And the first years are, fundamental anatomy, chemistry, pharmacology, pharmacokinetics, and then once you get into your third year, you're more in clinicals. So you're rotating through the hospital. You have on-site and off-site clinical rotations, and they're required clinicals. And then you can have your, whichever extra ones you wanted to choose. There's a word for that, but I can't think of it right now. You have your extra ones, right? Whatever your interests are that may be outside of those quote unquote required rotations. So I started off in a surgical mindset. My dad's a vascular surgeon, and I was always thinking, I'm very good with my hands. I like to cut things up, and I like to cure issues. I like to sew. As a ballerina, I would always sew my point shoes, and I like to sew other types of things. And so the artistic component and curative component as a surgeon really intrigued me. And as I was in my clinical rotations going through, you have to round, but you also have to pre-round, because when you're in your med student phase, you kind of do all the crap work, right? So you want to be there, you want to be prepared, you want to be helpful to the team, specifically to the residents, and you want to put a good face on so that they recommend you to a residency program. It's all about relationships and how you form those relationships, and you want to work hard. So I found that the surgical side was not only exhausting, getting up at 3 a.m. every single morning and on call all of the time, but I started to realize it wasn't exactly what I wanted. I wanted to combine surgical with something that gave me an answer, because the surgeons just send the specimen off to the pathologist, and they then follow up with the pathologist. They get a little love note. We sent them on pink paper, so they were love notes about what the diagnosis was. And I said, I kind of want to know what that answer was. I know we cut it out and that was fun, but that's over now. So then I started thinking a little differently, and although I wasn't quite ready to go to be a pathology mindset, because I thought that was nerdy, I transitioned to a different type of surgery that is otolaryngology, or ear, nose, and throat. And from there, you can specialize to become a facial plastic surgeon, which was also very interesting to me. Very unique, combines my love of aesthetics and injectables with a surgical component. And I said, how do I get into this? Let me do a rotation in ENT. And so once you finish third year of medical school, the fourth year, you have several months that you specifically focus on what you really want to do. And I said, I'm going to do ENT. And I have several friends in the field, and I dove right headfirst into that. And last thing I knew, I was up at 2:30, 3 a.m. sucking mucus plugs out of people's brains. And it was awful. I mean, awful. I said to myself, I don't even know what is happening right now, but this is not for me. So I finally, after all those mucus plugs, said, I'm going to go to pathology. And my team is laughing at me in the background. I'm going to go to pathology and I'm just going to thrive there. And it was called PIG, the Pathology Interest Group. And I ran over to my friends that were in that and my mentors that I leaned on secondarily, and they welcomed me with open arms, and the rest was history. So then by that time, I was into my fourth year, about 3 months. And that's not late to decide what you want to do, but it was relatively late. I was a little bit more pressured. And so at that time, you have to start interviewing at programs. Well, I guess you have to apply first. So you apply for residency programs and you receive interviews. And from those interviews, you decide, and the school decides, or the university decides, do you like them or not, essentially? And how do you want to rank these schools that you potentially would be accepted to, or these universities, academic institutions? So it's completely out of your control. I know what I want, right? But maybe that university doesn't want me. And that's why it's called the match, because you really don't know. And it's very, very hard. I, at the time, was single, didn't have any dependents. I was able to move anywhere I wanted to move, which was easy. But watching my friends who are married with kids and families trying to coordinate not only just their match process, but maybe their significant other was also going through the match. I mean, it is a time of uncertainty, of turmoil. It's chaos. But you just keep going because you think it's normal, right? Because it's normal. So I interviewed at a bunch of different programs, loved a lot of them, and really loved one that was up here in Boston, Beth Israel Deaconess Medical Center. And after you decide that you want to rank a program number one, you also want to make sure they're going to do the same if you really want to be there. Or are you okay being at one of your top three? And that's usually what you think about. So I would stay in touch with them, I would visit, I would shadow, I would talk to people in the program, trying to get a feel of, are they going to rank me number one or not? Because of course I don't like to lose, and that would be somewhat of a loss for me. So long story short, in March, I had spent some time up in Boston with the program, and on the day of the match, it's a big deal, which I think has probably changed now. I went to University of Florida College of Medicine, and it's a big, set up with all these tables, and you bring your family and your friends or whoever you want to bring, and I started sweating thinking about it, because you're like, oh no, I don't know what is in that letter that's sitting up on the stage. I don't know what's in there. And it's a whole process of you literally open this letter and see where you're going in front of everyone. And you can tell right away. And it's funny because why do we do that to ourselves, right? It's literally torture. But I think deep down, most people, considering they're type A individuals, kind of have an idea of what it says in there. And that may be from conversations, communication, whatever it is. But I pretty much had an idea that I was going to get my number one. I don't remember if I had a reason for that, but I kind of knew. But there are people that it doesn't happen to. So it's this whole presentation, you have lunch and whatever, and then they start calling you up. And the other thing is you can decide if you want to open it in front of people or not. So that's another thing. But I opened my letter and started crying, and I was by my sister, and it was just so incredibly overwhelming. But then you start to look around and you see some sad faces and you see some crying and people leave the room. So it's really emotional, and it's a time of change. It's a time of excitement. It's a time of, you want to exhale because you've worked so hard for that 4 years, which you have no idea what's coming because it's even worse. But it's just that feeling of exhilaration and hopefully excitement that you are now on to this next phase of your life. And then you literally have a month to uproot your entire life. You move, you have to find a place to live, all within 30 days. And it's completely unreasonable, but that's how we're built, I guess. So, the purpose of this, and I guess I'll go back one piece of information, is the day before the match, you will be notified if you didn't match or not. That's also stressful. So if you didn't match to a program, and it's typically the programs that are extremely competitive to get into. When I was there, it's things like dermatology and ophthalmology and plastic surgery and orthopedic surgery. Those are very, very challenging to get into. And it's not only academic wise, but it's because there's a limited number of programs that are available. So you'll be notified the day before if you are matched or not. And if you're not matched, it's called the scramble, I think. and you scramble with programs to try and find someone outside of the match that will take you in. And if not, you have to find something to do for that year. But anyway, so that I think I wanted to share this with you to get some insight into what it takes and what you go through, because it's very different. Other professions that are phenomenal in aesthetics have a different process, and I look at people that are working really, really hard. Part of my team that has their nursing degree, but they're in NP school, they're very different. Doesn't make it any easier, but they have a little more control. But it shows the whole picture and the perspective of where people come from when they have different degrees. So then I fast forward through my pathology residency, and then I had to match and get accepted into dermatopathology program, which is even more competitive because you're competing against both pathology residents and dermatology residents for under 50 programs in the country. And not only that, but I don't want to just go anywhere in the country, so I want to be able to have a choice. So I was accepted into several programs, and one of them was MD Anderson Cancer Center, which is #1 in the country for dermatopathology, but it's #1 in the country because they treat a lot of melanomas, and they treat people from all over the world. And I realized that that's really important, but for me, of course, diagnosing a melanoma and understanding sentinel lymph nodes is important, but I didn't want my entire training to be focused on that. I wanted to be more well-rounded. I wanted to see the benign lesions. I wanted to see the rashes. I wanted to see the skin cancers and melanomas and all the other things. But I realized that staying up until 2 a.m. looking at 60 trays of 10 slides each or 20 slides each of sentinel lymph nodes trying to search for one melanoma cell was not what I wanted to do. So I dropped out of that. I withdrew. I wouldn't say I dropped out. I hadn't started yet. I withdrew my application from there a month before I was going to move to Houston. And I had a year, because the cycle is typically 2 years for fellowships, I had a year to decide what I wanted to do. And that year I tutored medical students, pre-med students. I had a wonderful year taking care of myself. Wow, that was amazing. I should do that again at some point. And then I was accepted into the University of Vermont Medical Center that has an incredible dermatopathology program. It's located inside the dermatology division. I still have dear friends and colleagues that are there, and I had the best year, including having my first baby there. So, and here we are. So that's another part of the story. But I hope that was helpful. I hope you now have a little bit of insight into what match day is. I'm sure you may have seen it on your Instagrams popping up. If not, now you know the process, and ask me any questions you have. Made me excited talking about that journey, a little exhausted too, but hope that was helpful and interesting, and I'll see you guys next time.